As an emergency room doctor, what was the fastest deterioration you've witnessed in a seemingly healthy patient? I once had a 36-year-old female patient come in by ambulance with abdominal pain, which didn't ring too many alarm bells as her vital signs were normal. There were no obvious abnormalities on palpation. The pain didn't tick any boxes that would usually tingle my spidey sense, not tearing, radiating anywhere worrying, worsening, or accompanied by other symptoms other than mild nausea, for example. The only other thing noteworthy was the fact that she had given birth to twins 6 weeks ago. So I was running through my mental list of potential postpartum things to worry about whilst my line of questioning was starting to make me fairly certain that a laxative might be all she needed. She was alert and oriented, speaking in full sentences, no shortness of breath, her color was good, but she hadn't opened her bowels in at least 3 days. And although her bowel sounds were normal, it seemed the most likely, when you hear hoofbeats, think horses, not zebras, explanation was constipation. I was just thinking that a quick ultrasound wouldn't hurt when she suddenly sat up with a look of absolute terror on her face, looked into my eyes, whispered, "Help me," and then lost consciousness. When we pronounced her dead around 30 minutes later, she had already been dead for around 29 minutes. An autopsy revealed that she had suffered a massive rupture of an abdominal aortic aneurysm. AAA is usually present with recognizable symptoms such as severe tearing pain that radiates to the back, palpable or even visible pulsatile masses in the lower abdomen, pallid or gray skin and sweating, and they generally don't occur in healthy young people, preferring to carry off the elderly. It hadn't even really crossed my mind, other that very fleetingly, and almost immediately discarded as a possibility in this patient's case. Just an edit, thank you everyone for the upvotes. Knowing that over 4,000 people have appreciated my anecdote enough to upvote it means I must have done something right, even if I couldn't save that particular patient. However, if you know fuck all about medicine, kindly refrain from suggesting that you would have achieved a better outcome in this case. Cheers.